Hi, my name is Bria Bennett, and I'm a student nurse at the University of South Alabama. Today, I will perform the urinary indwelling catheter skill. Insertion skill. I first like to acknowledge that I have performed hand hygiene, and I'll be performing skills 5 through 22, omitting number 21, and on skill 17, I will make sure that I only draw from the port. Okay? I will first remove my kit, and I will use this bag as a trash can, placing it beside my patient's thigh. Now what I will do is I will begin to open further away from me, only touching the 1-inch borders, and now closest to me. Donning my sterile gloves. I will now begin to open my drape, making sure that there is no space between the two. And I'm able to touch all of this because this is sterile, and I'll place it between my patient's legs. Now, moving my tray closer. First thing that I would like to acknowledge is that in a real hospital setting, I will open my data down and I will pour all over my cotton balls or cotton swabs. Now what I will do is I'll remove the wrapper from the catheter, and I'll dispose of it in my trash bag. Now, after doing this, I will now attach my water-filled syringe to my balloon port, and I'm verbalizing lubricating 1 to 2 inches for a female and 5 to 7 for a male. I'll place my box closer to the genitalia. Now what I will do is I will position my non-dominant hand, and I will begin to clean with the principle of asepsis. I will clean first the urethra of the female urethral opening, cleaning both sides, and then I will clean the midline from the clitoris to the anus. For the male, I will clean going from the urinary meatus outward. Now what I will do is I will explain the procedure to my patient, ask my patient to bear down as if voiding, and I will also ask my patient to take a deep breath during insertion. I would also like to note that the male penis is perpendicular to the body, and it will be held slightly with traction during insertion. I will begin to gently insert for the female until urine is returned, now advancing 1 to 2 inches, and for the male all the way to verification. After I have done this, what I will do now is I'll begin to fill the balloon, keeping pressure on the plunger. Now I will remove, and I will set this to the side. After I have set this to the side, I will begin to gently tug. Now I will advance the tubing. After I have done this, the next thing I will do is I will demonstrate how to use my stat lock. I will first use my skin protecting pad to clean my patient's thigh, allowing time for it to dry. Now I will attach the stat lock. I will open it first, and I will open it and I would remove that adhesive, and then I will attach to my patient's thigh before clipping it. Now this is how I will unclip it. Okay? The next thing I will do is I would like to acknowledge how my patient's drainage bag should be. It should be over this way, and I'll make sure that the drainage bag is hooked to either the bed frame, and it should not be hooked to the side rail or to my patient's bed rail. It will also be below my patient's bladder level. Okay? Now what I will do is I will demonstrate how to remove urine from the port. I will first kink it and clip the tubing. Now using my alcohol prep pad to clean the port. I will dispose. I will grab my luer lock syringe, which I am stimulating since I do not have one, twisting it into the port, and I will withdraw the urine. Okay? After withdrawing the urine, I will come over, keeping it upwards. I will uncap, making sure that I keep my cap upwards at all times as well. And I will begin to then place all of the urine into the specimen collection container, making sure that I do not touch the edges at all or inside the container. Now keeping it up, I will then recap and I will label it and send it off. Okay, and I will set this to the side again. The next thing that I'll do is I'll make sure that I undo any clamping. After I have done this, my next step will be to dispose of all of my equipment and my gloves, glove to glove, skin to skin. I will lower my patient's bed, raise the side rails, make sure my patient has his or her call light, and I will also make sure that my patient will have all of their necessities or equipment that they need for their level of comfort. I perform hand hygiene, and now what I will do is I will demonstrate the principle of asepsis by discontinuing my catheter. Okay, first thing that I'm going to do is I'm going to verbalize how I would collect the urine. In a drainage bag, I will use my graduated cylinder as well as my specimen collection cup, and I will point those downwards, and I would then unclamp the tubing, allowing it to spill. And that was one breaking sterility I am only trying to verbalize. I will allow it to spill into the collection cup. After it has done that and it does not touch the edges, I will then cap it back. And with my graduated cylinder or my specimen collection cup, I'll be able to measure it because it will have measurements on the side. So the next thing that I will begin to do is I will grab my 10 milliliter syringe and I will begin to loosen it. Now I will position it at 0.5 milliliters. After I have done this, what I will do now is I will attach it to the port and I will allow it to empty with gravity. Okay, it is emptying with gravity. Okay, as it has emptied with gravity, what I will then do now is I will then set it to the side and I will begin to then make sure that I withdraw the tubing by kinking it. Gently and slowly. And now what I would begin to do is I would document my patients. I would document I would first perform perineal care, and I would document the amount, the color, the odor, the consistency of urine. I will also document my patient's tolerance. I would document the water flow from the syringe. I would document the intactness of the catheter tip, and I would document any symptoms or signs and symptoms of a UTI, which may be fever, bladder spasms, it can be elevated white blood cell count. It can also be the need to urinate urgently. Now what I would do is I would plan to assess for any voiding for 4 to 6 hours, and I would like to acknowledge that if there was no voiding, I would palpate my patient's bladder, and then what I would do is I will have a bladder scan obtained. Thank you, and this will conclude my skill.